I begin by dividing the donor area into 14 distinct regions using a donor template. I calculate the total number of follicular units in each region using the derm light and a 10 square millimeter reticule. This allows me to determine the percentage of grafts I've extracted from each region. Since all patients are different, I use a test kit with 4 different size punches. I determine the proper size punch to use on the individual patient. I use a suction-assisted score, lift, look, and cut down the direction of hair growth method to manually extract the grafts. I begin with a depth of 2 millimeters and then adjust down or up. Once the proper punch is chosen, I switch to the PCID extractor. Punch size is determined by the degree of splay and the attachment of the outer root sheath to the adipose, as well as the attachment of the outer root sheath to the inner root sheath. I point the serrated tip punch on the PCID straight down the direction of hair growth. The sharp edge results in minimal follicle deflection. This helps to keep the follicles inside the diameter of the sharp cutting edges. This demonstrates the use of the PCID in a non-shaven donor area. I simply incise 1 graft at a time in each region using the same straight down the shaft technique. I move the hair out of the way using a hair clip. We pre-trim the donor area prior to the beginning of the extraction process. If you like, you can use the self-filling injection device to add tumescence to the donor area with normal saline. Again, the PCID is directed directly down the direction of hair growth. This results in minimal follicle deflection, beautiful grafts, and minimal transection of the follicles. I remove the grafts I've already cut by gently easing the grafts out. We use the ATO or aid to extraction to remove the grafts. The ATO holds 25 grafts. One may apply as much force as necessary with the tip of the ATO without damaging the grafts or impairing follicle growth. I like to keep as many hands on the scalp as possible when doing a procedure, so that we can finish a procedure as quickly as possible. Each person on the team has a specific task. Here we have 2 nurses placing grafts, 1 nurse extracting grafts, and 1 nurse using suction to keep my operative field clear. We can finish a 2,000 graft case in 5 to 6 hours using this all-on-hands deck approach. We apply a viscous solution of A-cell to the extraction sites to help follicle regeneration and improve donor site healing. We spray activated PRP or platelet-rich plasma to the recipient area. The healing is much faster and better with A-cell. We measure the follicle regrowth using cross-sectional trichometry and evaluate the donor area for follicle regeneration. Here the follicle regeneration is 64%. Here's an example of plug repair. After shaving the plugs, we begin with manual extraction of the individual follicular units within a plug. We then switch to the PCID and proper punch size to mechanically extract the individual follicular units. We then will use an ATO or aid to extraction to remove the intact individual follicular units. If there is a stray hair within an individual follicular unit, we will often use an 18-gauge needle along with suction assisted extraction to remove the individual follicle. The healing in such cases is absolutely remarkable and quite normal in appearance.